Do you frequently feel like your heart pains sometimes? Or maybe you suddenly get high fever after a mosquito bite. You might think it's just a normal flu, but it could be something more serious, like dengue fever. Dengue is a common illness in tropical and warm places, especially after rains when mosquitoes multiply. Imagine you went outside, got bitten by a tiny mosquito, and then 2 days later you feel super weak, your bones ache, and your eyes hurt when you move them. That's dengue playing tricks on your body. It's not rare, millions of people get it every year. So it's important to know what it is, how it happens, and how to stay safe. What actually causes dengue? Let's play detective. It's not caused by bad food, cold weather, or stress. It's caused by a sneaky virus called the dengue virus. But the virus doesn't fly or walk. It rides on a special mosquito, the Aedes mosquito. This mosquito is like a tiny flying needle. If it bites a person who already has the dengue virus, the mosquito picks up the virus. Then, when it bites someone else, like you or your friend, it injects the virus into the new person's blood. This mosquito loves to bite during the day, especially in the early morning or late afternoon. It likes clean, standing water, like in flower pots, old tires with rainwater, or uncovered water tanks. So, if your neighborhood has these, the mosquitoes could be breeding there, waiting to bite. How do you know if you have dengue? Let's pretend your body is sending you warning messages. First, you get a sudden high fever, maybe up to 104 degrees Fahrenheit, like your body turned into an oven. Then, you feel pain behind your eyes, like someone is poking them when you move. Your head hurts badly, your muscles and joints scream in pain. Some people say it feels like breakbone fever. You might get a rash on your skin, like red spots that don't fade when pressed. You feel dizzy, tired, and sometimes vomit. In worst cases, your gums might bleed, or you might see blood in pee or poop. If you've been bitten by mosquitoes and feel even 2 or 3 of these symptoms, it's time to see a doctor. Don't wait. How do doctors know it's dengue and not the flu? They don't guess, they test. A simple blood test can check for the dengue virus or the antibodies your body makes to fight it. One common test is called NS1 antigen test. It works best in the first few days. After that, antibody tests IgM and IgG help confirm. But here's the key. There's no special medicine that kills the dengue virus directly. So treatment focuses on care, like drinking lots of fluids, coconut water, ORS, or juice, to avoid dehydration. Rest is like giving your body a recharge. In serious cases, where platelets drop too low or you start bleeding, the doctor might say, you need to be in the hospital. There, you might get IV fluids or even a platelet transfusion. Never take aspirin or ibuprofen. They can make bleeding worse. Paracetamol is safer for fever and pain, but only as much as the doctor says. Can you stop dengue before it starts? Yes, think like a mosquito detective in your own home. Ask yourself, where is there standing water? That old pot in the backyard, the clogged balcony drain. Empty them once a week. No water, no baby mosquitoes. Use mosquito repellent on your skin or clothes. Sprays, creams, or even bands. Sleep under a mosquito net, even during the day if needed. Wear full-sleeve clothes when mosquitoes are active. Involve your family. Make it a weekly mosquito hunt game. Also, communities can clean public areas and spray safe larvicides. One small action from you can protect not just you, but your neighbors too. Prevention is cheaper and easier than being sick in bed for a week. What's new in the fight against dengue? Scientists aren't giving up. Recently, a dengue vaccine called Dengvaxia was made, but it's only for people who had dengue before, not for everyone. Another vaccine, Qdenga, is now approved in some countries and can be given even to people who have never had dengue. Cool, right? But it's not 100% strong against all 4 types of dengue virus. Also, scientists are using clever tricks, like releasing special mosquitoes infected with bacteria called Wolbachia. These mosquitoes can't carry the dengue virus well, So when they breed with wild ones, fewer dengue-spreading mosquitoes are born. Cities like Yogyakarta in Indonesia saw dengue drop by 77% using this method. So the future might have fewer mosquito bites and fewer sick days, thanks to science and smart ideas.